Hello and welcome to video 1 of the 3-video course, Medicare, What's It All About? No, we're not talking about Alfred, and I know you remember that Dionne Warwick song. Anybody know who starred in the movie Alfie? If you do, let us know. Hi, I'm Howard Mamano. That's me in the lower right-hand corner on the right, and on the left is my business partner, John Rogers. And we'll be your guides throughout this course. Our firm, Rogers & Mamano Financial Group's mission statement is quite simple. We teach people how to build a life of financial security. And Medicare is a very important part of that. Please remember our number 1 rule. You do not do anything financially unless you understand it. By that we mean you're able to explain your decision to your spouse, your brother, your sister, your friend, whomever, why you did it, not just because somebody recommended it. You may have heard Medicare and Social Security referred to as entitlements. Please allow me to explain. Your whole working life, you've paid into Medicare and Social Security, and you are entitled to get the most out of them. They are not gifts from the government. You are entitled to Medicare Part A and eligible for Part B. They are yours. These informative videos will help you to understand just how to do that with Medicare. Unfortunately, there's a lot of misinformation out there, and we applaud you for taking the time to educate yourself. Unfortunately, for those that don't, mistakes may be made and they could prove costly. Forget some of the things you've heard, like Medicare is for the poor, that it's hard to sign up, the coverage is lousy and too expensive. False, false, false. All myths. John and I have helped many people with Medicare, and we know firsthand from working with family and friends how you are inundated with mail, emails, and even commercials on TV. There's so much information being thrown at you, it would be overwhelming for anybody. Our hope is that this course will help you to cut through the clutter. So let's get started. What we'll cover in video 1. I'm turning 65. Tell me about Medicare. What is Medicare? When to enroll? How to enroll? What do all those parts and letters mean? Who pays for what? Why you need Medicare. You may not know this, but there's a perk to turning 65, and it's called Medicare. I know. Who would have thought that? Keep in mind, Medicare is pretty good health insurance, especially in today's health insurance marketplace and all the costs. So what is Medicare? It's health insurance for people 65 and older, and some people under 65 with certain disabilities, and any age with end-stage renal disease. However, it doesn't cover all of your health care costs. What do those letters and parts mean? Part A, hospital insurance with some skilled nursing facility, home health care, and hospice care. Part B, doctor's visits, outpatient hospital services, clinical lab tests, preventive services, and durable medical equipment such as wheelchairs and walkers. Part C, Medicare Advantage plans, which can be HMOs and PPOs, includes Parts A and B and sometimes Part D coverage. These plans are provided by private insurance companies. Part D, Medicare prescription drug coverage plans that help pay for outpatient prescription drugs. These plans are provided by private insurance companies. Medicare insurance supplement plans, also known as Medigap plans. As the name implies, these plans were designed to fill in the financial gap between what Medicare pays and what it doesn't pay. These plans are provided by private insurance companies. I'm turning 65. When do I sign up for Medicare? Well, you have a 7-month window. The month you turn 65, the 3 months before you turn 65, and the 3 months after you turn 65. Sign up early to avoid a delay in getting coverage for Part B services. Get Part B coverage the month you turn 65. You must sign up during the first 3 months before the month you turn 65. If you wait until the last 4 months of your initial enrollment period to sign up for Part B, your start date for coverage will be delayed. No, you don't have to be retired to sign up for Medicare, and there are other times when you may enroll. However, you may pay a penalty if you delay. Medicare Parts A and B, also known as Original Medicare, what they cost and who pays what. So, what does Part A cost? For the majority of people, Part A is free. If you or your spouse have paid FICA taxes for at least 10 years. However, if you didn't, then you can pay to receive Part A. If that is the case, make sure to sign up when you are first eligible, or there may be a penalty. What you'll pay when using Part A, and again, that's for hospital inpatient services. Days 1 through 60, you're going to have a deductible of $1,288. Days 61 to 90, you will pay $322 per day. Days 91 to 150, you will pay everything except $644 per day. Everything past 150 days, you will be responsible for. Medicare will pay for the first 3 pints of blood, after which you're responsible for 100% of the cost of blood. Skilled nursing facility, which is not custodial or long-term care. Days 1 through 20, nothing of the approved amount. Days 21 to 100, you will pay $161 per day. More than 100 days, all costs will be on you. What does Part B cost? Remember, that's doctor's office visits and outpatient services. You're going to have a yearly deductible of $166. You're going to also pay a premium every month. It'll be based on your previous tax returns. And as you can see, most people will pay $121.80. If your income goes higher, as the chart shows you, you will pay incrementally more. What you'll pay when using Part B: 20% coinsurance for most services of the approved amount, plus excess charges. This points up the need for some people to have a supplemental policy which would pay either all or some of the coinsurances or deductibles. So how do you enroll in Medicare? Enrollment is automatic for those receiving Social Security or railroad retirement benefits. It is not automatic if you're still working. You would then enroll by going online at socialsecurity.gov. Or you may visit your local Social Security office or call them at 1-800-772-1213. We have found that going online is the easier and quicker of the three. If you're retired from the railroad, you would call 1-877-72-5772. When should you enroll in Medicare? You do not have to be retired, and remember, the initial enrollment period lasts 7 months. It begins 3 months before your 65th birthday, includes the month you turn 65, and ends 3 months after you turn 65. If you do have health insurance, coverage through active employment, yours or your spouse, that would be creditable coverage. Contact your Human Resource Department and/or Benefits Administrator first. COBRA does not count as creditable coverage. Therefore, if you're on COBRA, sign up for Medicare Parts A and B. There are other times when you may enroll. However, if you delay, you may pay a penalty. Why do I need Medicare Parts A and B? Besides the need for health care coverage, sometimes under the following circumstances. You want to buy a Medicare supplement policy. You want to join a Medicare Advantage plan. You are eligible for TRICARE. Your employer requires it. Contact your Human Resource Department and/or Benefits Administrator. Let's do a quick quiz review on I'm turning 65, tell me about Medicare. Question number 1. How many months is your initial enrollment period when you are turning 65? 7 months. What does Part A stand for? Hospital insurance. What does Part B stand for? Doctor's visits. What does Part C stand for? Medicare Advantage plans. What does Part D stand for? Prescription drug plans. What does Medigap stand for? It's another term for Medicare supplement plans. Congratulations. John and I figure that you've probably gotten 100%, so we're giving you a gold star. Please watch videos 2 and 3 of Medicare, What's It All About. In video 2, we go into much more detail on the Medicare Advantage plans and the Medicare supplement plans. The who, the what, and the why. In video 3, we'll be going into Part D, the prescription drug plans, answering the question, do I get coffee with the donut hole? Congratulations on taking the initiative to educate yourself on this very important topic and for watching video 1. Your free copy of the booklet, Turning 65, the 5 Medicare Key Tools, what you need to know about Medicare, go to the website that you see on the screen. You may also go to our website, www.rnmfinancial.com. Thank you again for watching video 1, and don't forget to watch videos 2 and 3.